A nurse will call you with instructions. Have lab work completed 1 week prior to the appointment. Hold medications as directed by the nurse. Wear something comfortable. Have a driver bring you to and from the procedure. You may have clear liquids after midnight, but do not eat any solid food. Arrive 1 hour prior to appointment. A nurse will record your vital signs, blood pressure, heart rate, oxygen, and temperature. You will be asked to read and sign consent for the procedure. Dr. Iqbal or his physician assistant will discuss the procedure and address any questions. On the day of the procedure, an IV will be inserted for hydration. Your groin will be shaved and a urinary catheter may be inserted. You will be brought into the procedure room by our staff and placed on the procedure table. Your leg, groin, or neck will be cleansed thoroughly for vein access. A sterile drape will be placed over you. During the procedure, you will be connected to a machine to monitor your heart, blood pressure, and oxygen. Medications will be given to help you relax and reduce pain. Ultrasound and X-ray is used to help guide a tiny plastic tube called a catheter through your veins. The procedure will take around 1 to 2 hours. Bed rest is necessary for 2 hours as directed by a nurse. A nurse will continue to monitor your vital signs and vein access site. If stents were placed during the procedure, you may experience low back pain or pelvic pain, which typically resolves after a few days. You may take Tylenol as needed. You will be started on a blood thinner for 6 months after your procedure to prevent narrowing of the stents while you are healing. You should not have a dental procedure for 30 days after stenting is performed. You will be seen for a 30-day follow-up visit after your procedure. An X-ray called a KUB will be ordered to check the placement of your stents. Please have the X-ray done just prior to your follow-up visit, and make sure to bring the CD with you to your appointment. You cannot lift more than 10 pounds for 1 month to prevent the stent from shifting. If you require a note for work regarding the weight restrictions, please tell your provider. If you had a gonadal vein embolization, you may experience heaviness or pain in the lower back. This can be relieved with over-the-counter medications such as Tylenol. Wearing compressive support undergarments is recommended after the procedure. Avoid strenuous activity or exercise for 30 days. You may resume normal activity otherwise. No baths, hot tub, or swimming for 3 days. You may shower 48 hours after the procedure. You may resume your normal diet. Be sure to drink extra fluids over the next several days to help flush the contrast dye out of your system. Remove the dressing after 48 hours. Do not remove it dry. Remove it in the shower to help loosen the adhesive. Wash the area with a mild soap and rinse. Apply a Band-Aid for 1 day. Do not scrub, rub, or apply any powders, lotions, creams, or ointments to the area. If a lump, drainage, or pain occurs at the access site, please contact our office. If you develop painful swollen leg, call the office. If you are taking metformin, you should not take it for a full 48 hours after the procedure. If you are taking blood thinners such as warfarin, Xarelto, Pradaxa, or Eliquis, continue as directed by the prescribing physician.